Or more than 69,000 cases of the coronavirus. Yesterday was the deadliest day on record for the United States since the outbreak began. 930 people have died in the U.S. New York is the epicenter of the outbreak in our country, with known cases doubling every few days. Meantime, Los Angeles Mayor Eric Garcetti said Southern California is about 6 to 12 days behind New York City. He said that's when he expects a spike in cases and deaths there. Joining us once again this morning, Dr. Hemel Cothry, the Chief Medical Officer for Dignity Health of the Central California Division. Dr. Cothry, thank you so much, sir, for joining us again.
Oh, absolutely. My pleasure.
Okay, so yesterday we saw a spike in new cases announced here in Kern County. In fact, it was our biggest spike to date. We now sit at 25 cases total in Kern County. Do you think we'll continue to see these big spikes?
Unfortunately, I think we should see a spike for the next few days as the tests keep coming in and as they validate those results.
Do we have a backlog of tests right now?
We do. I know I think there's about 400 still waiting and still pending results.
And how long have those tests been waiting there? Like how long have people been waiting to hear if they have this or not?
One of the things is we were waiting anywhere from 3 to 7 days. We're now waiting from 24 to 36 hours. So the testing has improved significantly.
And does that mean that those tests are going to be run in that long? Or if I go get a test today, I should know within that time frame?
So this is at the hospital level, and I'm not sure if they're prioritizing us over the outpatient world. I think the outpatient world, if you went to one of the urgent cares, it may take a bit longer.
Okay. So Los Angeles Mayor Eric Garcetti, we just mentioned, said that he believes LA is about 12 days behind New York. We know that NYC, that New York in general, the state, is the epicenter of the outbreak here in the U.S. He seems to be predicting that LA is soon going to be following suit. What do you think is going to be happening to our south?
Well, so like he said, LA is about 12 days behind. I think we're about 10 days behind LA. So, it's going to take its time, but it's going to come up here as well.
Do you think that LA is going to become the new epicenter?
I would not be surprised if it does.
And why is that? What plays into that?
We have a mix of cultures there. We have people traveling from all over the world to LA all the time. So, puts it at a little higher risk. They're also a city as opposed to one of the rural areas. The people are actually closer in terms of living as well.
Okay. So where is our curve in the U.S. this morning? We just reported 69,197 cases of COVID-19 in the U.S. That's according to Johns Hopkins University. So where is our curve? Are we still on the upslope? Are we starting to level out at all?
Unfortunately, I think we're still on the upslope. Probably a few more weeks.
I'm sorry, Dr. Cothry, you cut out there again, but you think that we still have a few more weeks to keep rising on that slope?
We're going to be on the upslope probably for a few more weeks.
Okay, before we could see anything that start to level off. All right, so
that's my belief.
Let's talk a little bit about how other countries are doing this morning in the outbreak, specifically ones that we could perhaps learn something from. In Germany, the COVID-19 mortality rate is about 0.4% compared to some places about 4% worldwide. What do you think that Germany's doing right?
I think they started with the social distancing. They've also started on several treatment options, and we haven't seen a lot of benefit on those in terms of those treatments. But I think they recognized this problem and they started working on it quickly. We as well are working just as fast. Our mortality rate right now, I believe, is at about 0.2%.
And that's across the country right now?
Correct.
Is that encouraging to you?
It is. It is very encouraging. We were expecting, anywhere between 3 to 5%. So, being that low, I think is very encouraging.
And again, that's 0.2%.
Correct.
Okay, so how does that compare to the seasonal flu?
We're anywhere between 3 to 3.5% for the seasonal flu, so a lot higher.
For the seasonal flu than for COVID-19 right now?
Correct. And we've also taken drastic measures to try and limit the amount of virus that's spread as well. So we typically don't do that for the seasonal flu, as you well know.
Absolutely, yeah. These are definitely some very drastic measures that have been taken. If someone gets coronavirus and they have mild symptoms, or perhaps they're even asymptomatic, how long does it take for the virus to run its course in that person?
So once you get the virus, it's in your system for 14 days before you'll even get symptoms, and those symptoms last anywhere from 5 days to an average of about 12 days.
So after that 12-day incubation period and then 12 days of active virus in your body, does that mean you're in the clear?
For the most part, yes.
Okay, so say, for instance, because we know a lot of kids have been out of school now for about a week now. So if they had been out of school and completely isolated for that time period, they hadn't been to the grocery store and in contact with anyone else outside of their home, are they then safe to go visit their elderly grandparents?
Potentially. But the problem with kids is, they've run into other kids and they could then pass the virus on to them. So as long as your kid, if you know your kid's been exposed and is completely safe now, yes. But we weren't testing every single person, so it's hard to say.
Okay. So what things can we do to boost our chances of survival if we happen to get coronavirus?
The biggest thing is, stay indoors, stay hydrated, stay well hydrated, try and keep away from other people. But, if you get sick, if you're getting more shortness of breath, get to the hospital, because this thing moves pretty fast.
How fast are we talking?
Within days. We've seen people, come into the ERs and say, hey, I had a mild cough a few days ago, and now they're extremely short of breath, and now they're getting admitted to the hospital.
So someone could be at home, very mild symptoms, think nothing of it, and then suddenly it could strike a few days into the illness?
That is correct, and that's one of the dangers of coronavirus. The flu, takes a milder course. It takes longer to, get its full symptoms. Coronavirus, however, moves very fast.
Very quickly in their system. Can you describe the testing process to us? How does that work?
Sure. So what we do, there's several ways of testing. We do the nasopharyngeal swab, which is in your nose. We do the oral swab as well. Quest Laboratories now has a sputum test where if you can bring up some phlegm, they can test that as well. So there's 3 different ways of testing.
Okay. All right, Dr. Hemel-Kothari, we thank you so much for joining us this morning. Now, Dr. Kothari is also going to stick around and do a Facebook Live with us and answer your viewer questions. That'll happen around 7:05 this morning on our KGET Facebook. So stay tuned for that. Get your questions ready. Dr. Kothari, thank you as always.
My pleasure.
All right.